I'll use a local anesthetic to numb up the area that we're gonna put the leads in at, running them up to the right spot. You'll go home, wear this thing for 5 days or so. Over the course of that 5 days, you'll be in contact with the representative. You'll make adjustments. Then we talk about it when you come and visit. And we'll pull the leads out, which is no big deal. Basically, I'll take the tape off, I'll have you take a deep breath and pull them out and put Band-Aids on it.
Removing the tape is the worst part.
The tape is the worst part. So this is a spinal cord stimulator trial. We're using Boston Scientific products for this, an Infineon lead, and we'll talk about that in a little bit. Nancy has had a prior lumbar fusion, continues to have some significant pain that's radiating down her leg and in her back. She's failed other interventions like epidural steroid injections and medications, etc. And she's just trying to find a way to help improve the pain that she experiences so she can have a better quality of life. So one of the things we talked about is considering a spinal cord stimulator, the goal being to obviously modify the pain that she experiences. And today we're going to do the trial, see if we can get some benefit over the next several days. At the end of that time, we'll talk about whether or not this is something we want to move forward with and to work towards implantation. To help her feel more comfortable, I'm going to use some lidocaine, which is an anesthetic, numbing medication. Try to make this a more comfortable experience for her. The initial little experience feels like a pinprick and a bee sting. I'm numbing up 2 areas. There'll be a lead that will go on each side. She's obviously quite comfortable. All right, we're going to start this introducer. Picture. Okay, I think that's going to be good. This is an Infineon lead. This is the trial lead that we'll use. They've already got it set up for me. I'm going to introduce this into the epidural space. Our next goal is to move this superiorly. You can see that the lead is going up into the epidural space. Second one should be a little bit easier as we're able to identify the appropriate depth angle that we want to take on this. The goal here is to introduce the second lead and run it up right next to the other one. As you can see, the depth looks the same. You're just going to advance. You can see there's one that's darker than the other. So what we're doing now is we have connected a sterile electrode. Lindsay is handing that up to the head where the Boston rep is going to connect it to his computer. We'll wake the patient up at this point, start the stimulation field to see if it can give her coverage where she's been hurting at. It's usually about a 5-day trial. Over the course of that 5 days, the representative will be in contact with the patient on a regular basis. The patient will have a controller that help adjust the programming, and what the technology does is it is able to create the field in a variety of patterns to help alter the pain sensation the patients have. At this point, I step out of the way and let the nurse tie these leads down with stair strips and some special tape, and we'll see her in the recovery room.
So I'm able just to point and click on this screen that matches the fluoro image that we have where the leads are placed, turn on the stimulation, and then move it in real time, and she just kind of tells me where she feels it, and I move it based on her feedback. Okay, it's going to go off. It's going to turn down just a little bit. Is that a nice light feeling? Okay, tell me when it's light. So right there, it's just barely there. Okay, that's what I'm looking for.
Really, rehabilitation after this procedure is minimal. They really don't have to do anything beyond what they would normally do. In this procedure, we just ask that they don't do any extreme bending or twisting, no real lifting. And that's primarily because we want to keep the leads in place. Most of my patients that do go to a permanent placement do find that they are able to decrease their narcotic usage and still have the quality of life that they're looking for without the side effects of narcotics.